Speech pathologists are university-trained allied health professionals who work in the area of communication, understanding language. It means using language to speak, but also to write and to read. We also work in the area of fluency, so that means you might have a child who's stuttering. We work in the area of voice, so people can get problems with their voices. But speech and language also includes the sounds of the language, and some children have difficulty in making the sounds, in producing the sounds. And language also includes grammar. So there's those areas also that we work in. When we see children in the early stages, we might have a little child in front of us who hasn't got any words yet and who's not talking. And so for a parent, they might be thinking, why am I seeing you? So part of what our role is to help develop the child potentially speaking, but also if they're not at that stage yet, actually giving them an alternative means of communicating, working with the parents and with the family to actually develop those skills. If we have a little one who's got speech or who's got some words starting, a part of our role is to actually help develop their speech, to develop their understanding of language, to work on play. Play is a very important aspect of that with children, and if we think about it, that's how children interact and socialise with each other, is often through play. So we would work on those sorts of skills.
Very often the children have lots of words, but what they're missing is that functional context of how do they use the words to get what they really want and need, or to express what they're feeling and thinking. And so it becomes really, really important to demonstrate to parents that, yes, isn't it fantastic that your child's got words and such a great vocabulary, but now we need to help your child to actually apply that in really important everyday situations to get across their meaning.
So knowing that each child is an individual, trying to be prescriptive about how long a child might need therapy for is actually quite a challenge. And we know that family circumstances, children's circumstances change, and so our therapy needs to change as well with those circumstances. So again, for a little child who's perhaps in kindergarten or at childcare, they're going to perhaps have therapy more regularly. Once a child moves into school, the therapy program might look different for that child. So if it's a really little one, we often see 2-year-olds, and often we might be the first or second port of call for the parents of those little ones. And people's understanding often in the early stages is the child might not be talking or have very few words, so that's the focus often. So part of what we would do in those early stages is explain very gently to the parent about words being part of communication, but talking more about early communication and the skills that the child's got and the skills that we want to build on that are all related to communicating and getting the message across. We all know that some little ones get very frustrated when they haven't got any speech and any words, and so it's really important that they've got some way of communicating what it is that they want and that people understand it easily. It's easy for them and it's easy for people to understand, and that might involve using pictures, using photos, it could be using some objects, it could also be using some signs as well. So there's a range of things that we would use, that we have that we know that are effective, and we will choose those, we will work on those with the family, with the child, to develop their speech.
And some children even move on to more technologically based devices. So when you hear the word AAC, what we mean by that is alternative or augmentative communication. And that encompasses non-technological augmentative systems, whether it's signing and pictures and pointing to pictures, but it also then encompasses the technological side of things, and there's a whole range of devices out there, and your speech pathologist will help you to determine which device better suits your child's needs at the time.
But what we really want and what we really need is for those skills that we're teaching the child to be then used in their environment. So a big part of what we do is to liaise very closely with the child's broader team, and that would mean going into perhaps a childcare centre, to the kindergarten, liaising very closely with the school, with the teachers, to actually let them know what we're doing, what the child's skills are, what we're working on, so that those things can be implemented across the board, because we know that that's the best way that the children learn. So we've got a training component often that we would do perhaps in our clinic. We might be working at home with the children. We do that a lot. Some of us work in childcare centres, but it really being inclusive with the team, with the broader team, and of course with the family as the central component of the work that we do.
It's really important for parents to be involved in the therapy sessions because we need to teach them how they may be able to get the best out of their child, how they may be able to learn the skills from us and then apply them. So a really important part of our role is the coaching. So we demonstrate and we model and we show. And from that point, we then coach the parent bit by bit to try the same sorts of strategies with their child. And we then help them to perfect those skills so that they can take those skills and really generalise them and embed them naturally into the home environment so that it's not therapy, so that it's not just drill and practice, so that it is part of the naturalistic situation that the child is in, and it's an everyday occurrence. It just becomes everyday communication. Very often we are the first professional that many parents will see with their child because they will be experiencing situations because the child might not be talking or there might be some tantrums and behavioural issues, and we're often that first person that they'll come with their concerns about their child. And so what we then do is take them along the journey, do some assessment, try and work out why are these behaviours presenting themselves, or why is this child presenting with developmental differences. And from that point, we may then decide that we need to start to gently kind of look at perhaps a whole formal diagnostic assessment around autism, and then consider perhaps suggesting a referral to a paediatrician who will then perhaps look at a multidisciplinary assessment to confirm a diagnosis of autism. And as part of our role, we also do full comprehensive communication assessments, looking at how does the child comprehend language? How does the child express himself, whether it's non-verbal or verbal? What level is the child playing at? What other developmental differences are we seeing? Are we seeing some sensory issues here where then perhaps there may be an occupational therapist may need to be involved? The behavioural considerations as well. So as a team of professionals, this is a team who would then come up with firstly assessments, then conclusions and recommendations for perhaps a treatment intervention program for the child.